Please make your choice by moving the arrow over your selection and clicking a button. This program is intended to demonstrate how Compact Disc Interactive can complement existing medical training materials. It brings to life static pictures, simplifies complex processes, and offers a student the chance to test their understanding. Of course, this demonstration disc only features some of the interactive possibilities available to this medium. A complete program could include simulations, detailed case studies, cross-referencing linked data, and so on. Students have the opportunity to take control over their own learning needs. They can study the material at their own pace, repeating concepts they find difficult as often as they like. Please make your choice by moving the arrow over your selection and clicking a button. A tumour or neoplasm can be defined as a lesion which results from the autonomous or relatively autonomous abnormal growth of cells that persists after the initiating stimulus has been removed. The term neoplasm is synonymous with the medical meaning of the word tumour. Cancer refers specifically to a malignant tumour. Malignant neoplasms develop in about a quarter of the UK population, the risk increasing with age. In fact, over 70% of all new cancers develop in people over 60. Note that the decrease shown on this graph after the age of 79 is mainly due to the reduced population size. The most common malignant neoplasm in the UK is lung cancer. However, for UK women, breast cancer occurs more frequently. In 1989, 32% of all cancer deaths for UK males were caused by lung cancer. 16% of cancer deaths in UK women are from this disease, but the incidence is rising. The mortality rate varies between different tumour types, and despite modern therapy, the mortality rate for some types of tumours is high. So we can see that the incidence of different neoplasms varies according to the sex of the individual. Where an individual lives is also important. This table compares cancer incidence in England and Wales with that in Ahmedabad, India. There are clearly wide variations. On the whole, however, it's likely that epidemiological data underestimate the true incidence of cancers. This is partly because not all tumours become clinically evident and may never be found unless a thorough autopsy is performed. Also, due to poor health care in some countries, a cancer might simply not be diagnosed at all. Moving on to structure, a solid tumour consists of neoplastic cells and stroma. On this histological section of an invasive squamous cell carcinoma of the cervix, the tumour cells appear as the dark purple areas. These cells reproduce, to a variable extent, the growth pattern of the parent cell of origin. The stroma, which supports the tumour and provides it with nutrition, consists of the lighter staining connective tissue. Tumour stroma always contain blood vessels. In this histology of an astrocytoma, which is a primary tumour of the brain, most of the picture is occupied by numerous blood vessels, some of which can be seen to contain red cells. These blood vessels form the vascular stroma of the tumour and are essential for its growth. The growth of a solid tumour beyond a diameter of about 2 millimeters depends upon vascularization. The ingrowth of new blood vessels, or vascularization, is dependent in turn upon the production by the tumour of tumour angiogenic factors, or TAF. Vascularization enables tumours to grow, as shown by the rapid increase in the curve of this graph. Very large tumours, however, undergo central necrosis because the blood vessels aren't able to supply all the tumour's nutritional requirements. This causes large tumours to grow more slowly, as is shown by the third segment of the growth curve. Tumours can exhibit a range of different shapes. Sessile tumours are flat, without a stalk. In contrast, tumours forming pedunculated polyps grow out from the surface and are connected to it by a stalk which often consists of normal tissue. These are commonly found in the large intestine. Papillary tumours are characterized by fronds of tumour tissue. These are commonly seen on the skin or on the bladder surface. Fungating tumours form a solid mass which may partly protrude from the surface, but usually also invades the underlying tissue. Ulcerated tumours, such as commonly occur in the gastrointestinal tract, tend to have prominent or heaped-up edges, bordering a central ulcerated area from which blood and other materials, such as tumour cells, may be lost. Annular tumours completely encircle the hollow viscus in which they arise, most commonly in the large bowel, where they cause obstruction. Whether a tumour is benign or malignant can often be deduced from its appearance. The picture shows an adenomatous polyp of the colon. Although this common lesion is benign, it is pre-malignant and predisposes to cancer of the large bowel. The polyp has been elevated to show the stalk which connects it to the underlying bowel wall. This stalk commonly consists of normal tissue, enabling easy removal at endoscopy. Finally, this is an example of a common malignant neoplasm. It shows an adenocarcinoma of the colon. The lesion has an ulcerated surface from which blood may be lost and has invaded the underlying bowel wall. Please make your choice by moving the arrow over your selection and clicking a button.